Hi, my name is Jessica Adams. I am a Polk State College student. I am making this video for my portfolio presentation. I went with a hard copy, and to be honest, I go with a hard copy on everything because that's how I am. I have a hard copy organizer, calendar. I know it's in my phone, but there's some things that just can't change right now. I like the way it's organized and you actually get to see it. So that's what I went with. So here is my hard copy. It's a binder. And the first page, sorry, hang on. The first tab is my resume. It's a very short resume right now, but hopefully I'll add to it. And actually I just updated it because I just applied for a position in the trauma ICU at Lakeland Regional, which is where I currently work. And I actually had some help from my manager to complete my resume recently, so this worked out perfect. And then my next tab is certifications, the IHI certifications, the ones we require here, and then ones that I did in previous courses and through the hospital. And then I have all my certifications, my ACLS, my BLS, and I used to be certified med-surg, and I recently let that expire because I am going to be starting my CCRN after I'm done with this. And so that's where I have my license and everything is in there. And then my project. My project was on the TICU. Well, it was in the trauma ICU. When I started in the trauma ICU, I was absolutely terrified of neurological patients, neurosurgery patients, neurosurgeons, and their entire staff. The one thing that kept me from going to trauma ICU was the neuro side of our unit. It's mostly a trauma neurocritical care. So when I finally got into it, I found that I was really lacking a lot of knowledge on all the head bleeds we get. We get pretty much 3 or 4 different types: a subarachnoid hemorrhage, intracranial, IPH, or intraparenchymal, subdural. You know, there's different types, but there's ones that we get most often. So when I was orienting and going through all that, I found that there wasn't a lot of education on the head bleeds. You just kind of knew your patient had one. You didn't really know where it was at. You knew the name of it, but you didn't quite know where. And you didn't know the neurosurgeons and what they like, because we have a couple neurosurgeons. We have 3. And they all like different things. They all go by different evidence, and depending on what they know and what their best practice is what we go by. So a couple years into this, now in my project, I realized that is the same issue among new nurses and older nurses. We still get, a subarachnoid, and we know it's in the subarachnoid, but we don't quite know what the symptoms are, and how do they differ from other head bleeds, and what should we expect when we get these patients from the ER or from the OR. So I collaborated with my manager, and I collaborated with the nurse that I was shadowing, which is a nurse practitioner in trauma. And we decided that we needed more education on head bleeds because we found that, randomly, that a lot of nurses always said, you know what, I know we get head bleeds and I know how to do a neuro assessment, but I'm not really sure what to expect and what should I expect from the doctor. So we came up with a little chart based on some education found on the internet and through journals, and through our neurosurgeons and what they use for their most up-to-date evidence. And we kind of went by some, I don't know if you can see this, but we got some CAT scans. We looked up some of those and we made a chart, and we also found some charts on the internet that help us out on what all the different types of head bleeds are, the most common types. There's always those outliers that you don't know what to expect, because we don't get those kind very often. So all those aside, we wanted to focus on the ones we get the most often. So we came up with these, and a little help from these charts to look at the symptoms and what to expect medication wise, and what needs to be given right now versus something that's going to be scheduled, and it's just a part of the plan of care. So on admission to a couple of patients, we made these charts and made symptoms and what to expect, a full 8 by 11 page on admission with the admission packet. That includes our page that we put all the diagnosis on, and the tests, and kind of what we use in rounds. And the nurses used it, and they liked it. It's a little wordy, is a little too much, it's a chart, and then it's just a lot of words. So we talked about maybe making it a badge, part of our badge. We have a couple things on our badge. We have a LifeLink card. We have what the codes are of the hospital. But specifically for our unit, they talked about wanting a quick reference. Yeah, this is good. This is a good education piece, but we aren't going to pull out an 8 by 11 piece of paper every time and look at it when we get an admission. So we talked about maybe on the second cycle, go ahead and doing a smaller one, getting kind of some of the words out that didn't really need to be there or that repeated themselves throughout. And we came up with a smaller one. I don't have the smaller one because my manager has it. But there was a miscommunication there, and she took it. But it's basically a smaller version of the chart and the doctors that we use, and what kind of medicines they use and everything. So it's a smaller version, and it would be on them permanently, and maybe they haven't had a head bleed patient in 6 months, and they want to know, oh, I had that about 6 months ago, but I forgot what this doctor likes, and what to expect from this doctor, or what to expect with this patient and their symptoms. So they wanted to have a little reference on them all the time. We have to do NIH stroke scales, and we have a little card that is placed in the unit that is there for when you question, your patient's NIH assessment. Did they really drift? Did they not? So it's there for you. So they wanted something like that for our head bleeds, our most common head bleeds. On the second cycle, and like I said, the first cycle was the 8 by 11 piece of paper with the admission. So the second cycle, we kind of shrunk it down to stuff that doesn't get the stuff out that doesn't really matter or repeated itself, and put it on a couple people's badge behind their name badge and everything, and went through a ton more admissions, and they found that they were looking at it during report, a lot more during report than when the patient arrived, just to have a quick reference, like, this patient is coming, this is what I got in report, this is what I can expect, now what do I do? So that worked out a lot better. Some of the newer nurses thought that we should have a whole education piece, a class on it, and then have the papers from the class so that they can go back to it and look at it. But, with time, and, when you're getting a patient from the ER, it's quick, gotta go. So in the second cycle, it seemed to work better as a badge. So they can look at it, flip it, and look at it real quick and say, oh, I'm getting a subarachnoid. These are the symptoms, and the doctor's right here, and this is what to expect. We get a subarachnoid patient with one of our doctors who is very strict on the orders. They have to stay in the ICU for 10 days. They have to get a certain medication, and then another doctor will get it, and they start the medication, but they don't need to be in the ICU for 10 days. So it just depends. So that was my project, and I felt really good about it. It worked out very well, and my manager and the neurosurgeons, they took a look at it. They loved it. They said, yeah, we could kind of build on this actually if people do want a class. So that was that. Reflecting through the BSN program. When I first started out, I don't need my BSN because I started long before they started requiring them. But as a personal goal, I was told one time that I wouldn't be able to do it. So challenge accepted. I'm a single mom of 3 kids, and I said, I'm going to do this. In order to get where I want to be, this is what I have to do. I want to be in education one day, and I love student nurses. I love students. I love teaching nurses. I love precepting. I love that fresh mind that thinks everything is just so wow. I put my first IV in, and I did all these things, and that just warms my heart. So I have a very close relationship with education, and I love it. But right now, when finishing my BSN, I would say now I've learned a lot. I've learned a lot about my community. Most of all, I've lived here for years, and my kids are growing up here. And to get in depth, to find another area of nursing that you didn't even know had anything to do with nursing. Going and volunteering at Visti. I know it's always been there. Never really knew. I knew they give free meals, but I never really knew everything they did. From putting together plastic bags to, helping them with their free groceries to the car. And knowing that has something to do with me and my community was probably the most that I've gotten out of this program. A lot of tedious paperwork. I am tired of writing papers. I'm going to be completely blunt and honest. I'm just over the papers, but altogether, this experience just being in my community in a totally different way, not just being at the bedside and seeing these people outside of the hospital, getting free food and, all these services that my community supplies and actually could do more. I got a lot out of that. And something I'm going to change or do differently with my practice is think about the patient more than just in the hospital holistically. What do they do every day? How do they take care of themselves at home? Just clipping somebody's nails is going to make a difference. And you kind of forget that, years into nursing, you just get tunnel vision into what you're doing. So this opened my eyes to more than just at the bedside. This opened my eyes to my community and to the lady I'm behind at Walmart who could be my patient one day, and watching her, struggle to use the pin pad because she's got arthritis, and having that role and watching this outside of the hospital was the learning point for me. So I appreciate this program, and I appreciate what it's done for me. And actually, I don't think that my portfolio is very very organized, but seeing everybody else's, and I think, wow, I need to be more organized. And that's what this program has taught me, to be more professional in presenting myself and presenting what I have and what I've done and being proud of what I've done. I used to throw away all those, what the little certificates for being a good employee. Like, I can't hang on to them for a little while. Oh, okay, it's been a year. I'm done with it. Hanging on to those for longer, keeping them and showing them at other jobs. So once I figure out what I want to do, what my master plan is, right now I'm taking it a year at a time. I want to get into education eventually, but not right now. It's just not good timing. And right now I have smaller goals. But that's my dream job, is to be an educator. So thank you for watching my presentation.